So, you have a condition that requires for you to get a cerebral angiogram done for further evaluation or even possible treatment. Have you heard about cerebral angiogram in the past? No worries, I will guide you through each stage of this procedure so you know what to expect and be prepared for this angiogram. A cerebral angiogram is a diagnostic procedure used to visualize the blood vessels in the neck and brain. A cerebral angiogram is performed in a specialized room designed specifically for angiography procedures. The room is equipped with advanced X-ray machine and computer systems to visualize blood vessels in the brain with the help of a contrast dye injected through a catheter. Let's start with preparation. Patient will be assisted to the procedure room, where a dedicated, specially trained medical team will be assisting the patient with proper positioning, IV and sedation if needed. The patient is positioned on the angiography table, and an intravenous line is established to administer sedatives or medications if necessary. The groin area is cleaned and sterilized to reduce the risk of infection. A local anesthetic is administered at the puncture site for patient comfort. Next step is insertion of the catheter. Once the area is anesthetized, the physician makes a small incision in the skin of the groin to access the femoral artery. Using a needle, the femoral artery is punctured. A guide wire is inserted into the artery, and a catheter is threaded over the wire into the femoral artery. The guide wire is then carefully removed. Advancement to the cerebral vessels. The catheter is carefully advanced through the blood vessels, navigating toward the carotid or vertebral arteries, depending on the area to be studied. Fluoroscopy, real-time X-ray imaging, is used to guide the catheter precisely into position near the blood vessels supplying the brain. Contrast injection. Once the catheter is properly positioned, a contrast dye, also called contrast medium, is injected through the catheter into the arterial system. The dye makes the blood vessels visible on X-ray images. Multiple X-ray images are taken as the dye moves through the vessels, helping the physician assess the condition of the brain's blood supply and detect any abnormalities such as aneurysms, stenosis, or arteriovenous malformations. Imaging. The physician may rotate the angiography equipment and capture images from different angles to obtain a comprehensive view of the brain's vasculature. This helps identify any potential blockages or anomalies in the arteries. Removal of the catheter. After the necessary images are obtained, the catheter is slowly withdrawn from the femoral artery under fluoroscopic guidance. Hemostasis and closure. After the catheter is removed, the femoral puncture site must be closed. Direct pressure is applied to the site for several minutes to stop any bleeding. In some cases, a closure device is used to seal the artery more securely, which may involve a collagen plug or sutures. If no closure device is used, manual pressure is applied until bleeding stops. Monitoring and post-procedure care. The patient is monitored for a period of time to ensure there are no complications, such as bleeding or hematoma formation at the puncture site. Depending on the patient's condition and the nature of the procedure, they may be observed in a recovery room for several hours or overnight. Discharge or further treatment. Once the patient is stable, they may be discharged with instructions on how to care for the puncture site and when to follow up with the healthcare provider. Disclaimer. This is a general outline of the steps involved in a cerebral angiogram from the groin puncture to closure. Specific details may vary based on the medical facility, the patient's condition, and the techniques used by the physician. Thanks for watching. Please like, comment, and subscribe our channel for more contents like stroke, carotid stent, aneurysm treatments on AngioSavvy.